Hello friends, let us now learn some important points about Phyllodes tumor. This Phyllodes tumor is also called as cystosarcoma phyllodes, or we can also call it as serocystic disease of Brody. Okay, this Phyllodes tumor actually has a dual origin. Here it originates from the mammary epithelium and it also originates from the connective tissue stroma. So it can be either benign lesion or borderline lesion or malignant lesion. But on cut section, if you see, you will see presence of leaf like material, leaf like appearance is seen, and you will also see presence of monoclonal stroma is seen. And in between you will see presence of cystic areas because of hemorrhage and necrosis. And one unique feature of this Phyllodes tumor is that here mainly the nipple, chest wall and the breast skin are not involved. Remember, nipple, chest wall and breast skin is not involved. Okay, this is not chest, breast skin are not involved. So if you see the clinical features, the breast is very massively enlarged and it gives a bossylated appearance. Because of its massively enlarged, it causes pressure atrophy of the skin. There is no fixity of the skin, or no that is the tumor is not fixed to skin, or it is not fixed to chest wall. There is no nipple retraction or ulceration or deviation. The major route of spread here is the hematogenous spread, and the most common site of metastasis is to the lungs. Most common site of metastasis is to the lungs. This is metastasis, and major route of spread is hematogenous route. Then if you were asked, the investigation of choice is biopsy. Then how are you going to treat the disease? Treatment is that, because if it is benign appearing, then we can do wide local excision with 2 centimeters margin. If it is a malignant appearing cystosarcoma phyllodes, then we can do simple mastectomy. Here you will not do modified radical mastectomy, is not performed because there is no lymph node metastasis. So this is about the Phyllodes tumor. Thank you for watching.